Hello friends, welcome back to Dr. Passion. Today we are going to talk a little bit about home isolation. As you know, the COVID-19 cases are on the rise. A lot of patients are getting corona positive. They're testing COVID positive. So we're just going to talk a little bit about what do you do at home to get yourself treated rather than going to a hospital. Now, as we talked in the last video, almost 90% of the cases are either mildly symptomatic or completely asymptomatic. That means they do not have the symptoms or they have very mild symptoms which really do not need a hospitalization. So what usually happens is, we either have to go to a COVID care center, which is run by a government, or we have to get a treatment in the hospitals. And then that's when the hospital charges us their fees, and we are not very happy about it. So this video, we are going to talk about how we can self-isolate ourselves at home and take the care. The guidelines that I'm going to mention today have been provided by Government of India and Ministry of Health and Family Welfare. So without further ado, let's jump into those. All right, so let's first see who is eligible for home isolation. So any patient who is asymptomatic or mildly symptomatic is eligible for home isolation. They should have the requisite facility for home isolation. Now, what is that requisite facility? It only means that you have a separate bedroom with an attached toilet. So that's the only requirement that you need if you want to self-isolate. Now, patients who are immunocompromised, that means patients who are HIV positive or HBsAg, that is hepatitis B positive, those patients are advised not to self-isolate. Again, any patients who are above the age of 60 years and who have diabetes or they have hypertension, they have any chronic kidney diseases, chronic lung diseases, chronic liver diseases, people who have heart diseases, uh, people who have cardiovascular diseases. So these patients are advised not to home isolate. Again, a treating doctor can decide if there are if the comorbidities, that means these conditions are under control, your diabetes is okay, you're taking your heart medicines, your hypertension is in control, they can go into home isolation, but it has to be certified by your medical doctor. You have to have a caregiver who will take care of you 24 by 7. That is a requirement from the Ministry of Health and Family Welfare. The guideline also mention that along with the caregiver, you should be able to get in touch with the doctor 24 by 7 through any communication device. It could be over a video call or it could be just over a phone call. The caregiver should take prophylactic medicines as per the guidelines and as per their medical doctor. You need to download the Arogya Setu app. It has to be active through Bluetooth and Wi-Fi. That is another requirement. The patient should agree to monitor his own health, and he should allow the government officials also to come in and check on him from time to time. The patient should fill in a self-isolation form. So basically, I have a format right here. So the isolation form says that I'll take care of myself. I have a caregiver who will take care of me as well. It should be an undertaking that you need to sign. Obviously, the guidelines I have mentioned in the description below. So please go through it. And if you have any questions, I'll be more than happy to answer any of your comments. So the next topic is, when do you seek medical advice? So now you're at home. When do you actually seek a medical advice? How do you know that I should be going to a doctor or not? I should be visiting a hospital or not? So the criteria is very simple. If you have difficulty in breathing, if you have a pulse oximeter at home, it looks something like that, then that pulse oximeter should be showing your oxygen saturation more than 94%. If it goes below 94%, you should be seeking medical attention. If you have difficulty in breathing, if you have tightness in your chest or chest pain, definitely you should be seeking medical attention. If there are any mental confusion, slurring of speech, if your lips or fingertips show bluish discoloration, that is actually when you need to go and see the doctor. What is the role of the health officers or the district officials? So basically, they'll ask you to download the Arogya Setu app. They'll request you to keep it on Wi-Fi or Bluetooth 24/7, so they know that you are at home and not roaming around. Also, they need access to come and see you at least once a day if required, and they need to check on you on whether you are doing okay, whether you have difficulty in breathing or your stats are okay. So they need to keep a track on you. So if your condition worsens, they need to take you to the nearest healthcare facility. So here are the things that you need to take care at home. Number one is you should be wearing a mask all the time. That mask should be a disposable one. So you need to discard it every 8 hours. So in a day, you should be using at least 3 masks. But if it gets wet or it gets soiled, then you need to replace it. Now, when you are throwing away the mask, remember to disinfect it with 1% sodium hypochlorite. Now, how do you prepare that 1% sodium hypochlorite? So you take 1 liter of water and you put in 7 grams of bleaching powder and you mix it well, and that's how you make 1% sodium hypochlorite. Now remember, you need to make sodium hypochlorite every single day. So whatever is left from the previous day, you need to discard it, and in the morning you need to prepare a fresh one. So that's one of the requirements. The next requirement is isolation. So you need to be alone in your room without getting in contact with anybody else, especially children, elderly, and anybody who has comorbidities like hypertension, diabetes, or any heart disease. You need to take a lot of water. You need to eat properly. You need to take foods rich in vitamin C and multivitamins, and you need to eat nutritious food. You follow the respiratory etiquettes all the times. Now, hands should be washed as frequently as possible. It should be washed for at least 40 seconds. Check out the link on the top to know how exactly to wash your hands. The things that you use, so any personal items that you're using, it should not be shared with any of your family members. Clean the surfaces, especially the flooring, the tabletops, the handles, and anything that you use during the day. It should be cleaned with 1% sodium hypochlorite. Obviously, you need to follow your doctor's advice, the medications that they have given you, any advice that in particular they give you. You need to listen to them. You need to follow all those advices that they give. Last but not the least, you need to check your temperature on a daily basis and report it to your doctor and any government officials. Now, I have a link on the top again, which will mention you how to check your own body temperature using an infrared device. And you can check your own body temperature at least 2 times a day. So you're keeping track of if you are having any fever or not. Okay, so what does the caregiver have to do? So here are the instructions for the caregivers. So the number one is mask. So as they're giving care to the patients, they need to wear masks at all the times. The same rule apply. You need to discard the mask after disinfecting it in 1% sodium hypochlorite, and you should not touch the front portion of the mask. While removing, you need to remove it from the sides. You also need to change the mask if it gets dirty, if it gets soiled, or if it gets wet. So always use a fresh mask while attending to the patient. You should not be touching your face, nose, or mouth while giving care to your patient. Now, hand hygiene, as mentioned, you need to wash your hands before and after wearing the gloves. While serving the food, if you're serving it in a steel utensil, then you need to give that food with your with the gloves on. After the patient has eaten the food, you need to collect those utensils with gloves in your hands, and you need to wash those utensils with gloves on. You should not wash the utensils with bare hands, or you should not handle the soiled food, or you should not handle the soiled utensils of the patients with your bare hands. It's a complete no-no. If you want to avoid all these steps, the best is to use a disposable item. So you can use disposable utensils to serve food to your patient. So they can, after having food, they can just discard it in a separate waste bin. Now, after washing the hands, it is advised that you clean your hands or you soak your hands with a paper towel. Now, if you have a cloth, then you should uh, disinfect it with 1% sodium hypochlorite if it gets wet. So I would suggest, instead of using a cloth, I recommend you that you use a paper towel, which you can just discard it after cleaning your hands. Again, it is not advised to handle any of the secretions of the patients. So it could be any oral secretions, urine, feces, or any of that sort. The caregiver should not handle those secretions. If you really have to, then you should be using gloves to handle those. Again, if you are handling their linen, you should be wearing gloves. Any linen that is used throughout the day, any clothes, any garments that the patient uses, it should first be soaked in 1% sodium hypochlorite, and then it should be taken for washing. I would discourage using a washing machine where you are mixing both the clothes. The clothes of the patient should be washed separately in a separate machine if you have it. If you don't, you can just wash it with hands with gloves on. If the patient wants to wash his own clothes, that is fine too. But try not to mix patient's clothes with anybody else's. As I mentioned before, the food that you provide to the patient should be provided in the room that the patient is living in, and the caretaker should not enter the room if it's not required. You can just set the food outside, and the patient can then take it, and once he has eaten the food, he can then place it again on a stool outside his room, which then the utensils can be handled with gloves by the caretaker. But like mentioned before, uh, try to use disposable utensils, so you reduce the contact between the patients. The three main criterias of home isolation or giving care to patients while they are in home isolation is wearing gloves, wearing a mask, and using proper hand hygiene where you are washing hands with soap and water for at least 40 to 60 seconds, or using a alcohol rub where you are disinfecting your hands with an alcohol rub for at least 20 to 30 seconds. As a caregiver, while you are giving care to the patient, it is very important to monitor your own health. If you develop fever, cold, cough, runny nose, or if you have general weakness, you should report to the doctor immediately. And if they feel, they will get you tested as well, because your health is also of prime importance. Now, when do you really discontinue home isolation? So, the guideline mentions if you have been in home isolation for 10 days, out of which the last 3 days you did not have any symptoms at all, means you don't have a sore throat, you don't have cough, you don't have fever, then it's okay to discontinue the home isolation after 10 days. However, it is recommended that home quarantine should be continued for 7 days more. So total home quarantine of 17 days is advised. There is no need to do a swab testing after 10 days of isolation if you don't have any symptoms. So total of 17 days of home quarantine, you are free to resume your duties. As we have seen, it's very easy to do. Yeah, it's not so complicated to treat yourself at home for corona. The main criteria, again, like I mentioned, is the gloves, hand hygiene, and the mask, and to monitor your health on a regular basis. If a doctor is coming to your home every day, that's a perfect situation. The health authorities obviously will be keeping a track of you. You will be uh, self monitoring your health on a daily basis, and this is the best way to treat asymptomatic or mildly symptomatic corona patients, where you are with your family, you are in your own house, so you don't feel depressed. uh, you are with them, you are communicating with them, they feel they have you close to you, instead of staying in some hospital or in some covid care center where you are all by yourself. The You feel depressed. It is really best if you stay among your family and stay at your home and get treated. I feel this is the best way to treat asymptomatic and mildly symptomatic corona positive patients. Again, if you have any more questions, please feel free to comment in the link below. Don't forget to subscribe to the video. I'll bring you many more videos on things that you want to hear about. And please like the video, share this video with as many people as you can, because right now people are afraid of corona more than any other diseases. We don't need to be afraid of COVID. We need to face it, we need to fight it, and we can do it very successfully together. Thank you so much for watching.